A problem for many hospitals in our region right now, overcrowded emergency rooms. Rochester General Hospital is building a new structure outside their emergency room in the hopes of freeing up more space and improving wait times. Staff there saying conditions are largely due to staffing shortages over time. Erica Cost has been following the story for now and joins us live with more. Erica?
Good evening, Katrina. Well, if you look over my right shoulder, it's standing right there, and that is serving the purpose of minimizing those wait times, freeing up more space until a more long-term solution is reached. And part of the problem here is, as you mentioned, staffing shortages. The head of emergency medicine here at Rochester General says staffing shortages aren't anything new, but they've been made worse by the pandemic and even more so the past few weeks.
But the indirect effects as far as staffing and some of the vaccine mandates, that's what we kind of are seeing as far as some of our staffing challenges.
A major shortage across the healthcare system is trickling down to the ER. If you're not in a life-threatening situation, you could be waiting hours for a bed. Right now, the demand is double what's available for beds. Graham says he's hoping this new structure outside will help them turn a corner.
We work with our the hospital administration, as well as a ton of people have really joined hands to erect an external structure so that we can expand places that take care of patients.
They're also working with Governor Hochul's office to receive help and staffing. In the meantime, paramedics like Saeed Ahmad Mustafa are seeing the effect as they wait to transfer their own patients. Mustafa says it can be up to a 3-hour wait.
You basically come in from the ambulance parking lot into a hallway, and you're waiting literally in line to have a nurse evaluate the patient, sometimes do an EKG.
But even with the conditions, Mustafa says it's important the public knows to call for help if they need it. They always find a way.
If you've got chest pain, shortness of breath, allergic reaction, or something that just doesn't feel right, call the ambulance. Once you're in the care of the ambulance, you're in very capable hands.
Now, I've also reached out to the State Department of Health to learn more about how these hospitals are in communication with the governor's office, which they say they are. They sent me over an executive order she signed recently that will expand the workforce. It aims to bring recently graduated certified medical workers, those who retired, to bring those workers back, and also just workers from out of state. They also say in their response that facilities in New York State already had emergency staffing plans in place even before the pandemic. For now in Rochester, Erica Cost, News 8.
All right, thank you, Erica. URMC is also facing similar conditions in their emergency department. About a year ago, they designed a similar structure outside of the ER to expand clinical care at Strong Memorial Hospital.